Thank you, Mr. Chair. Thank you for joining me today as I bring forth a matter of great concern and shed light on recently proposed regulatory changes that will severely impact Medicaid programs across the country, including Texas, and have profound consequences on the 90 million Americans who rely on Medicaid to access health care. This year's the Centers for Medicare and Medicaid Services, CMS, introduced materials that challenge the statutory language governing states' long-standing methods to fund the non-federal share of Medicare payments. Two documents in particular have raised significant concerns. One, the Information Bulletin on healthcare-related taxes and hold harmless arrangements, and specific provisions of CMS's proposed rule titled Medicaid and CHIP Managed Care Access, Finance, and Quality. The amendment I'm proposing to Fiscal 24 Labor, Health, and Human Services and Education Appropriations Bill will protect the safety net in Texas and many other states and ensure that Medicaid beneficiaries continue to receive essential care by prohibiting federal funds from being used to finalize, implement, and enforce harmful policies that will severely limit states' ability to draw down critical federal Medicaid payments. For the most part, I applaud CMS for pushing forward with a comprehensive regulation to overhaul the structure of Medicaid managed care programs. I acknowledge the potential positive impact of certain provisions that could enhance access to coverage and care if implemented. However, there are legitimate concerns that specific policies within this framework will compromise states' access to vital financial resources, undermining the intended improvements. First, CMS's recently proposed changes directly contradict the understanding that Texas and other states have relied on for years to operate their Medicaid programs. As Judge Kernodle recently stated in his ruling enjoining CMS from using their unsupported interpretation, CMS may not rewrite clear statutory terms to suit its own sense of how the statute should operate. Second, the proposed rule expands CMS's authority over state-directed payments by granting the agency the power to withhold approval or retroactively deny already approved state-directed payments if it believes they are financed with impermissible non-federal dollars. This newfound discretion may introduce uncertainties into states' Medicaid financing structures, potentially hindering their ability to implement and maintain state-directed payments that contribute to the welfare of Medicaid beneficiaries. To sum it up, these proposed policies are an overreach and the latest efforts in a series of federal actions seeking to erode states' flexibility, increase oversight, and curtail arrangements that help hospitals down federal funds and provide much-needed access to care for not only Texas patients, but patients in many other states. If enacted, policies of this kind would accelerate hospital closures, limit access to care for low-income Americans, and leave states with a more significant financial Medicaid burden. I urge each of my colleagues to support this amendment and recognize the gravity of this situation. My amendment aims to safeguard consistent, predictable, and adequate funding, ensuring access to care for all Americans, especially those in vulnerable situations. Your support is crucial in protecting the stability of our hospitals and ensuring that Medicaid beneficiaries continue to receive the care that they deserve. At this point, Mr. Chair, I'll reserve my time.
For what purpose does the gentlelady from Connecticut seek recognition?
Mr. Chair, I claim the time in opposition.
Gentlelady is recognized.
I rise in opposition to the amendment. This amendment would prevent millions of Medicaid and CHIP beneficiaries from accessing critically necessary care. The Biden-Harris administration's proposed rule seeks to strengthen access to coverage for children and adults covered by Medicaid and CHIP to access the health care providers and services they not only need, but that they are entitled to. The proposed rule would set a national standard for maximum wait times for routine medical appointments for primary care and obstetrics gynecology. An appointment would need to be provided within 15 days, and for outpatient behavioral health services, 10 days. The proposed rule would require greater transparency on provider rates. The rule would require rate transparency to once again ensure an adequate network of providers. The proposed rule would require home care agencies to allocate at least 80% of the Medicaid payment to direct care workers' compensation. Once again, this Republican amendment would hurt our economy's children, seniors, people with disabilities, and the most vulnerable. I urge my colleagues to oppose the amendment, and I reserve the balance of my time.
Gentlelady reserves. Gentleman is recognized.
Well, I appreciate my colleague from Connecticut, and I think we probably have the same aim, which is to have care and access to that care. For states like Texas that chose not to expand Medicaid, this rule is in particular damaging. And again, I can't stress enough how the risk of the overreach of the federal government will hurt those who want to access care. Again, the proposed rule expands the authority over state-directed payments and has the ability to withhold the approval or retroactively denied already approved state-directed payments. So in reality, the access to care really is at stake. And again, I agree, we're both probably talking about a similar level of access. This rule will negatively impact that. I urge my colleagues to vote yes on this, and I yield back the balance of my time.
Yields back. Gentlelady is recognized.
Mr. Chair, I oppose this amendment, and I would just make a suggestion to the gentleman that Texas ought to expand Medicaid. I yield back.